I think it's noon and people are trickling in. I'll just give maybe 30 seconds to a minute for more people to join in and we can get started. Okay, I think most folks have joined. I'll start. Uh, I'll get us all started here. It's hard to believe it's end of summer here in Chicago. So for most of us are coming here from Chicago today for this another instance of CPT Developer Program DevChat. I'm really excited to bring you Adriana and Julia, who are from Rock Health, and Dennis will be introducing them shortly, but they'll be sharing some fantastic insights on the startup land and the investment trends and the tech trends that we're seeing across health tech landscape. So to get things started, a quick update, add questions in Q&A anytime, raise hands, and unmute yourself when called. Session recording will be available, and we will make it available on AMA Intelligent platform for all of you, which is your homepage for that program. And we'll talk about a lot of ideas, and we're excited to share them with you all the time, but no definitive feature timelines unless explicitly stated. So great. With that, today's topics are going to be, Dennis will be covering shortly CPT Developer Program updates for you all, which will give you insight into where we are, what we're seeing in the developer program itself. Then we'll cover healthcare innovation trends with our great friends from Rock Health. And we'll wrap it up with participant use cases and questions towards the end. With that, I'll hand it over to Dennis for CPT Developer Program updates.
Great. Thanks, Sandeep. Welcome, everybody. We're happy to go through a few different items today. The bulk of our time will be spent with our guest speakers. And to start with the program updates, I want to start with a poll question to get going. Start with the first one. We won't have a whole lot of time on these, just to get a sense of the first one is really just asking like what your relationship to the program is. Are you a regular CPT licensee? Have you licensed the dev license? Are you in the program but not a licensee? So a few different combinations of that. So it looks like a fairly even split between signed up for kind of both the dev program and a dev license, and then not signed up for either. So we've got some opportunity there to join the dev program and get a closer view into what the AMA is doing around this area. Okay, and then the second poll, please. So this one, just what are you working on? So are you building something new? Just here to listen? How far along in the process are you if you are building something? We'd love to get an understanding of what you're doing and where AMA resources can help you along the journey. All right, this is looking good. About 40% are just here to listen, but the rest are on their way to building something. Kind of even split between getting started and underway. So I'll end that. Okay, so some just quick stats about the program. We've launched a couple of years ago, and we're up over 2,800 participants. We're really trying to understand what people want from this program. It's not a very prescriptive program. It's more self-service. And then for getting royalty-free access to CPT codes, we've issued almost 400 of those licenses. So really trying to make CPT content more accessible and more transparent to the industry. And then what people are doing with that code set runs the gamut, mostly claim management type activities. That is not very surprising. CPT codes are used to get reimbursement for services and procedures, so that's not a big surprise. And then still exploring is another interesting one, where we want to foster a sense of taking content and trying to do new things with it, and so we certainly support that group that's still exploring. Okay, before the main event, we'll have one more poll. Let's run poll number 3. So this one is really what you're focused on. So we'll hear about some market trends in a minute here, and so trying to understand how this relates to you. Are you streamlining clinical workflows? Are you improving reimbursement workflows? Working on value-based care initiatives? Reducing impacts of staffing shortages? Or improving interoperability of clinical data, or other? Certainly not a definitive list. Give this just another second. Okay, so pretty even split between everything except improving reimbursement workflows looks to be the leader here at about 42%. So consistent with the aspects of the program where claim management and reimbursement is the primary driver. Okay, so moving on, it's my absolute pleasure to welcome our guest speakers for today. We have Adriana Krasniansky and Julia Croxon from Rock Health Advisory. Rock Health, more broadly, is a renowned health innovation organization that provides impressive resources to innovators at all stages. It provides funding and many programs that include summits and accelerators. Rock Health Advisory is the consulting arm, and they tackle broad challenges in really meaningful areas of healthcare. And so our speakers today both have degrees from Harvard, so that's certainly a promising start to kick us off. Adriana leads research at Rock Health Advisory, and she's gotten there by spending time in research and strategy roles in transformative health organizations. Julia is on the consulting team, and she's worked in life sciences and digital therapeutics, among other areas, so really informative into her consulting work. And they're here to share their insights on health innovation trends and where it matters to innovators like you. So with that, I'll hand it over. Welcome, Adriana and Julia.
Thanks, Dennis. Really appreciate that. Happy to go ahead and get started. I think, yeah, I can go ahead and share my screen now. Today, we really wanted to talk about two distinct things, kind of trends that are driving the future of healthcare innovation, and secondly, double-clicking into why it's hard to innovate in healthcare specifically, and some of the challenges and approaches to overcoming those challenges in healthcare specifically. Before we get started, did just want to double click on the purview that we have at Rock Health and what makes our perspective a bit unique. There are actually 3 parts to our organization. We have a Rock Health Capital, which is a venture fund investing in early stage digital health solutions, primarily pre-seed through Series A. So really has that focus at the earliest edge of innovation. We have our nonprofit arm, rockhealth.org, that's focused on improving equity within healthcare and digital health especially. And then we have Rock Health Advisory, which is where both Adriana and I sit, which advises enterprises and growth stage startups on their digital health and innovation strategy and implementation efforts. So we do look at the digital health and healthcare space more broadly as an organization through a variety of different lenses, and hopefully some of those different perspectives will be brought to bear in the trends that we highlight and talk about today. As we move through the presentation, as was kind of mentioned at the outset, we welcome questions, comments, engagement in the chat. We also do welcome you to raise a hand, come off mute, ask a question, but we will also have a bit of time reserved at the end of the presentation for questions as well. With that, we'll go ahead and dive in, starting off with thinking about the future of healthcare, where we're headed, and what trends that we're seeing. I think we can all recognize that healthcare is shifting and changing and has been for the last number of years. We see 5 distinct forces of change really as key drivers towards that future state of healthcare. We obviously saw a lot of disruption with COVID, and we feel that there's also a force of change associated with this new horizon, kind of beyond the emergency of the pandemic itself, which we're referring to as the next normal after COVID. We also recognize that there's significant affordability constraints driven by macroeconomic factors, as well as the pressures that various incumbent healthcare players are experiencing in their general operating practices. Costs are going up across the board for a variety of factors, and that's really creating pressure on organizations' margins. We also note that there's a bit of shifting as it relates to patient and ultimately consumer expectations, really with individuals becoming increasingly prominent in the role that they play in their healthcare experience. We see in the US the shifting of demographics. We have an increasingly diverse population with great cultural variation. And then we also see an increasingly aging population as well, with folks living longer, which kind of ties in some ways to the final trend. We do see a decline in mental physical health, in part driven by the increasing age. And kind of below all of this, as a bit of a foundation, we also have distinct enablers for kind of digital health and innovation in healthcare, which are advancements in technology and data, as well as kind of refining and building out more policy and regulatory guidance. We anticipate that the future of healthcare will be characterized by at least 6 features, and we'll dive into each of these on subsequent pages, but just to kind of frame up what we'll be talking about, the first is we see a number of additional players becoming providers beyond the traditional health systems, the traditional standalone clinical offices, and that's looking a lot different in kind of the future and where we're headed. We also see that care is becoming increasingly cohesive, both across different players providing care as well as different modes of care. In kind of parallel to this, experience for patients and providers is really becoming table stakes as expectations increase. We're also seeing from more of a life sciences perspective that the science of medicine is going digital as it relates to R&D, clinical trials, and then also in terms of the delivery of care, looking at that becoming more precise and personalized to individuals with the advancements in technology and availability of data. I think we're all familiar with kind of AI in this day and age. I'm sure everyone has been talking about generative AI in one capacity or another over the last 6 to 8 months, using ChatGPT in various ways. But taking a bit of a broader lens beyond just the generative element, we do see AI as a whole and kind of via various types of AI becoming more and more embedded across healthcare. And then lastly, we see data silos starting to become unlocked with greater access and interoperability so that data can be used to inform actions and delivery of care. As I mentioned, we'll double click into each of these features of this future state that we anticipate the healthcare environment shifting towards. The first being specifically about the increasingly diverse landscape of providers. In the kind of old world or traditional healthcare, we really saw four traditional types of players: the providers, the payers, pharma, device diagnostics companies, and then the distributors. In this new world, we're seeing an increasingly diverse set of players where the boundaries with which traditional players were operating are shifting, and we're also seeing new entrants looking to play a role in healthcare, specifically big box retail, as well as big tech players looking to get a slice of the pie. Oftentimes, we hear folks looking to enter healthcare saying, we want a slice of that $3 trillion kind of healthcare expenditure that the US carries year to year, and how they're doing so and how they're entering and looking to strategize, taking advantage of some of that opportunity can look quite different across these distinct types of players. As I alluded to, we're also seeing an evolution in care delivery itself. One example of this is that we're increasingly seeing different types of primary and specialty care. First, we're seeing this idea of virtual first care, where as much as possible from a care delivery perspective is being shifted into digital health, virtual care, ideally telemedicine type delivery. And there's a variety of different modes by which that's being driven and delivered. Second, we're seeing tech-enabled primary care, which is really looking to drive cost savings for payers, bringing in that element of technology. And then lastly, and kind of connected back to the prior page, we're seeing greater presence of retail care with in-person primary, preventative, routine care at different retail settings, both big box retailer and then kind of more of your local retail type players that are in the community and leveraging their pre-existing footprint to stand up networks of in-person care for primary care delivery. As I also alluded to, the patient is really transforming into the consumer in the context of healthcare specifically. Individuals are more often taking ownership of their healthcare journeys, their healthcare experiences, making intentional choices around the providers which they're seeing and who they're engaging with. This is enabled to some degree by digital technologies, availability of information, etc. They're also driving more influence in terms of the treatments that they're receiving, asking for specific drugs by name, asking for tests or raising questions related to suspected diagnoses. And this is happening all along the care journey. And really important to think about the experience of patients on that care journey and how that ladders up to what their needs and drivers are as consumers as well.
Julie, is there a question from the, oh, I think that might just be someone coming up mute. So what we're going to head to next is talking through, Julie did a great job of walking through some of the core engagement changes that we're seeing. There is a shift in terms of the players that are engaging with that US healthcare expenditure pie. There's a shift in the way that consumers expect to receive their healthcare or want to engage with healthcare players. Now, something that's going to feel really particular for this audience group as well is that the technology, the tools that we can bring into healthcare are fundamentally changing. The tools that we can apply within healthcare. One, there are more tools available. Second, there are more builder kits that make it easier for individuals who are technologists and innovators to apply new ways of thinking into healthcare. And there's more energy and momentum around this opportunity to test out new approaches. And again, that's really both the kind of Moore's Law technology kind of trajectory we're living in, and also the same way that we're seeing so much concentrated effort within digital or healthcare specifically, really ramped up after COVID. And so when we think about what the technology or advancements that we're seeing right now fundamentally change the landscape, we want to talk about some of those really key points that Julia mentioned. The science of how we do medicine is changing. We are now, every large pharmaceutical company uses some form of artificial intelligence to enable its drug discovery pipeline, identifying molecules, selecting and kind of matching those molecules and drugs to the best targets or treatments, realigning those. We're also seeing a real rebirth and reimagining of what clinical trials can look like and mean in terms of what setting, how consumers are engaging with them, how those results are being verified and tested. Diagnostics, many of us know the way that we receive treatments is changing regularly, or that we're matched to treatments and our diagnostics are made, is really changing in the sense that we are now able to let individuals know earlier on what they're at risk for. We're able to more quickly let them know and kind of what their concerns are, and we're able to do it much more cheaply. And that, again, is all an effort or kind of as a result of the technology that's being put forward. And the last part, as well as the precision medicine. We are now getting close, especially when we think about that pairing with diagnostics, to really think of a one-to-one care pathway for many patients. Next slide.
Adriana, do you, a personal interest of mine is digital twins. Have you seen much activity along that front, or has it gone up and down? I guess, what's your current take on that?
Well, it's great to hear, Dennis, because it's an interest of mine too. Digital twins, for those who might not be familiar, are there are slightly different applications when you're thinking about in a trial setting versus in a precision medicine setting. But ultimately, it's where you have an individual and you're able to create a data copy. So a copy on paper, quote unquote, of an individual, and then simulate how that individual might respond to different treatments or to different events within their life, right? So sometimes digital twins are used to plan surgery and think about different surgical approaches. They can also be, think about different treatment pathways for someone, for example, that has cancer. You can see how different digital twins respond. And then in a clinical trial setting, they're actually really interesting to think about kind of one-to-one controls and variable groups, right? And so if you can create a digital twin that's a control for someone who's receiving a treatment, you might be able to reduce the sample size that you need in a study. This is another example of kind of reimagining kind of the way that we do medicine. But it also requires a completely different understanding of our healthcare data, right? And so I think what you're seeing right now within the four on the screen are that a lot of these start in a way where there's really clear data lakes or data silos or data departments that they're working in, right? Digital discovery works within drug molecules, right? And then also thinks about the molecules of different diseases that they kind of connect to, right? And so if you can get those two to talk together, you can have the technology operate. Same thing within diagnostics. We already know in certain senses what we're looking for, and we understand in what kind of data ecosystems we would be looking for that. The next generation of reimagined kind of scientific approaches, I think, will come when you see those intersections of those different data ecosystems. And from my perspective, I think digital twins sit at the intersection of multiple ones of those. You kind of have to understand how to build and refine that, which is kind of at a very macro level, but you also have to work at that individual level of, do we have enough high fidelity data about one person to really, to a high fidelity, simulate how they're going to, how they would operate in different ecosystems. And so that's to say we are, I truly believe, at a Moore's Law juncture, and have been in healthcare, where technology advancements are only rapidly increasing because of the unlocks that computing power has, that data storage has, and that the kind of the foundation of what we're building upon offers. So I guess it's a long way of saying more to come, I hope.
Yeah, the perfect intersection. Thanks.
Yeah, of course. One thing I want to talk about with many of the folks in the room is you all are thinking about data, not just in that science of medicine approach. You're actually also thinking about the care delivery aspect of healthcare, right? What does it mean to engage with claims data? What does it mean to engage with personal data, something we just talked about when we think about those digital twins? And we can't really have these conversations about the ways that technology will transform healthcare when we don't talk about artificial intelligence. And so I know that many of you are either thinking about, reading about, or even maybe actively engaging with solutions that use algorithms or building solutions that use algorithms on healthcare data. And I think it's really important to remember that the way we think about AI applications in healthcare are kind of really in two camps, and both serve really important purposes, just slightly different. One is AI for efficiency gains, right? Where are we targeting inefficiencies within healthcare workflows? And so this is where you see a lot of the generative AI solutions today, thinking about virtual scribing, the ability for us to do things like really clean up or automate or streamline the way we bill and code for healthcare procedures, the way that we kind of store patient data or store patient history. This is really AI for efficiency's sake. And right now, we expect that this is going to be driving the majority of healthcare innovations, though we also expect that a lot of these efficiency gains will ultimately be consolidated into very large kind of enterprise level players, right? Because again, their margins are going to be coming from optimizing for those efficiencies. Now, when it comes to new capabilities, AI programs are unlocking things that otherwise we would not be able to do in healthcare. And this is, again, where you can do things like completely reduce the need for even a live clinical trial, right? Or even a control arm. Or it's going to help us diagnose in a completely new way. Or it's going to help us treat a disease in a completely new way. These are really high upfront cost opportunities. You need to, these are often the high risk kind of application of AI. And this is where we see a lot of really incredible startup players kind of pave the way. And then there, of course, there's a very high return for the new capabilities that are codified, implemented, and then ultimately realized within healthcare. Any questions just about the technology conversation we just had or the AI components?
Adriana, if I may, this is Sandeep. And
Sure.
this is some area that we've been also spending a lot of time, but just wanted to take your perspective from like trends and patterns that you've seen on production deployments particularly. Meaning I'm just trying to see if there were any learnings that you've seen that this group particularly can apply as they think about their AI solution. What I mean by that is certain type of AI solutions are actually getting deployed and getting to production faster than some are not seeing as much traction. If there are any particular segments people are more focused on than the other.
And when you're saying getting or deploying to production, right, I'm thinking about actually getting into the real world and get. And is there any specific healthcare setting that you're thinking about? Is this production, getting to production within a kind of health system, right, being like actively tested? Is that kind of what you're thinking?
Yeah, health system primarily. Yeah.
Okay, that's really helpful. I think something I didn't mention, which is really important, is that we talked about that efficiencies are kind of the biggest opportunities right now, or AI for efficiency gains. These tend to be prioritized based on where there currently is the highest need or the highest quote unquote leakage within an organization, right? And so the question is, where is the fire that needs to get put out is often what we hear from large enterprises who, many of which are, provider organizations, but also payer organizations and others who are saying, we just haven't either cracked the code on how to help our clinicians, right? We know that our clinicians are spending so much time with pajama time work. We know that there is a burnout. It is our fire that needs to be put out. And then the same way when you think about payers, they might not have the same level of kind of clinical burnout that they're dealing with, but you also will hear things like, this is just an inefficient, cumbersome process. There is a lot of leakage here, and we need to think of an approach. AI, ultimately, integrations are a risk for larger organizations. Until everyone's doing them, and then it's a status quo, we have to find the vendor that'll get us there the quickest. If you are going to be working with a partner to take on that risk, you have to find where they're already feeling like they are kind kind of where they're trying to stay afloat, right? Because then you have more ability to kind of make a case for change. And so what you're going to be looking for, fortunately or unfortunately, is where they're looking for the fire right now, or where they're looking for kind of that biggest sink. And so I think it's really important to think about, if you're an entrepreneur in this space or a developer, are you working on a mission critical problem for the organizations you're selling to? AI for new capabilities doesn't always have that same perspective in. So what you really have to do there is sell the vision. And that's where you see venture funding in particular being really important. Even to a certain case, philanthropy becomes really important in these spaces, because it's a really high upfront cost. And then the business case comes. I would say for most folks on the call today, and many individuals in healthcare, just healthcare IT, digital health, et cetera, you're going to be working on efficiency problems. And it's really important to stay close to the problem to understand how critical it is to the folks you're working with.
That's great. No, great insight. Thank you for sharing that.
Mhm.
One other point on your slide that caught my eye is IP protection favors in-house development or development via discrete partnerships. Can you explain that? Like, what do you mean by that exactly?
Yeah, it's a great question. So when you are making we talked about AI for new capabilities requires usually really high upfront development investment time. There's going to be a lot of stops and starts. You may need to make a really big investments in model development. For example, if you're working with AI, you might not be able to train an existing model. And because you're making all of those points, you want to really protect the return, the same way that you would for drug development. And so IP, or intellectual property, is going to be a really important consideration for those who are funding those types of products. And so you will see a good example of this will be in the pharma space, probably a little bit more than in health systems, because they just might have more of that capital available to make this kind of investment, is that they're really going to think about that IP. Right? How are we able to either patent this technology or be the sole kind of owner of this way of kind of looking for tools, or this tool? What you'll notice is that once again, something is more common in a marketplace, you'll see more willingness to share, because they also might be working off data exhaust. So another good example is drug discovery, right? Certain investments are very high IP because you're working in really specific areas. You're developing models or refining them to really specific use cases. And it's critical that you kind of maintain that intellectual property to maintain an advantage in the market. That's the only way the ROI calculation works. In other cases, let's say it's just kind of matching drugs that didn't work in certain trials to potential new targets, right? So it's kind of like a marketplace. In that case, actually economies of scale help. Right. And there's less of kind of in some cases, there's less of a kind of a preciousness around the technology. It's actually more of a data question. And then you don't have as much of the IP question, but that's really in many cases more of an efficiency. That's kind of when it moves from a new capability to something that many individuals will have or many companies will have. So again, think about it as that ROI calculation. Whoever you're selling to or whoever is sponsoring the new technology investment, how are they trying to kind of get the most upside and protect as much upside that matches the amount of money, capital or resources that they're putting into them.
That's great. That's great. Thank you. Thank you for sharing those insights. Very interesting.
Yeah.
You can proceed. And I'm just calling out other participants to post their questions in chat as well as you continue. Thanks.
I was monitoring the chat earlier, but I'll make sure I have it back up. Okay, great. And so we talked a little bit about the science of medicine, the difference between or AI and technology really transforming the science of medicine. We've talked a little bit about care delivery, specifically when we think about the efficiencies within it. I'm going to double click within that care delivery space, specifically around a lot of the use cases that the AMA holds within its network kind of players, right? And its network of expertise. And this is really about delivering care, helping to connect individuals to physicians and clinicians just more broadly, who are able to do things like see them, provide support, put them on the right pathway to healing and to long-term health. When we think about all the steps in that care delivery process, a lot of it, as we talked about, is going to be efficiency. Some of it's also going to be new capabilities, but we're going to talk about those two lenses for each of the following topic areas. One is content generation and summarization. We are in a real renaissance period of reimagining what it means for the provider to be an active player during a clinical visit. We're taking them away from the computer desk in many ways and giving them tools like mobile AI scribes or ambient scribes that listen in the room and allow them to kind of be back fully present in that human to human conversation. This is, again, enabled by generative AI, and there are multiple solutions in the space. It is an increasingly crowded space, and we are starting to see early signals of consolidation. But again, this is an opportunity area just by the sheer magnitude of how it will reorganize kind of the clinician to patient relationship. Conversational AI is something we've all talked about and engaged with in probably other areas, but we're starting to see its quote unquote renaissance period in healthcare as models become more effective and in certain ways safer to deliver certain supports of healthcare information. And so this can be things like symptom checking and helping to triage someone to the right level of care, like something we see with the K-Health to do, for example. It also could be things like chatting with a patient to help them schedule an appointment or navigate to how to use a certain benefit of theirs, or help them track their symptoms or side effects when they're on a treatment. So conversational AI, essentially the ability to chat with software that then tracks your inputs and provides best course recommendations, is what we see really coming next, in many ways out of the AI scribe race that we've seen. Imaging and the ability for generative AI to enhance, to identify points in images is just kind of unparalleled, but this has been a new capability that's now become an efficiency. Synthetic data generation is something we actually just started talking about with our clinical twins, digital twins. And this is really where you're able to generate net new data learned on prior data. So that's the synthetic data part, to provide you simulations that can help you make decisions in healthcare. So again, synthetic data is a very interesting, but also somewhat risky part of healthcare, because we have to be very careful about where it's used, and that we don't create feedback loops of AI being trained on only synthetic data, right? That kind of creates a dangerous closed loop system. We've talked about drug discovery, but the last thing that we haven't talked about is the importance of data infrastructure. So many of you all are likely developing solutions that support healthcare organizations or sometimes patients in accessing, navigating care, et cetera. But there's also the role that generative AI has in actually shoring up healthcare infrastructure. How are we getting code faster? How are we checking our security and our privacy? How are we running tests to ensure that hacking risks are not as high? Generative AI plays a role in helping us refine the code that increasingly powers our digital healthcare ecosystem, or digitalized healthcare ecosystem. And so for many of you who are kind of thinking more about these point solution or engagement approaches, I just want to make sure you're also thinking about the opportunity at the infrastructure level of data sharing, data security, data protection. That tools are increasingly helping smaller individuals kind of enter into this space and think of new solutions. Any questions about any of these opportunity areas we discussed? Okay, great. We just have a few more slides before I'll pass it back to Julia to kind of, wrap us out in terms of kind of key insights for entrepreneurs and innovators in the space. But the last thing that I do want to note is, amidst all of this technology evolution, something that really powers everything and continues to kind of grow is our data ecosystem. The United States, I would say, in many ways, is one of the leading healthcare markets in terms of understanding the value of the data that it provides, right? And what that means is that we are making really concentrated efforts at the federal level to think about how we store, support patient data, but also how that data is interoperable and used across multiple situations. And so the way that Rock Health defines data infrastructure and interoperability are those technology solutions that enable for back-end connectivity and conversation between systems. And they're going to optimize data use. Optimize for whom? On one hand, for the patient, most importantly, can they take their data to different places? We see data portability being a really clear focus at the federal level when we think about the roles that the ONC and other players are taking around healthcare data. Also, other kind of optimizing for health systems and our healthcare providers. If you go from one health system to another, are they able to connect your records? Are they able to learn about what you've had in the past without maybe asking you to do that intake again? And this is where we see a lot of the healthcare networks that are being developed. TEFCA just being kind of one of the infrastructural components there that are helping us get to this level of kind of interoperability. What's really changing here is that we're in a moment where we're bridging legacy systems and future visions. And so right now you're seeing a lot of these networks, marketplaces, kind of top-down federal and national initiatives that are trying to make historically siloed programs work together. I think we at Rock Health expect and believe that the next iteration will be interoperability at the core of the solutions we build, rather than those silos at the core of the solutions we build. And part of that will be policy mandated, and part of that will also be because we have to unlock the data liquidity, right? Data will be the commodity, and then the solutions that we build on top of that will be the net new value. What we expect this to do is, one, it's going to lower the barrier for many developers like you to engage with these systems. I mean, the AMA is a great kind of leader in this, right? In terms of offering data liquidity, data access, right, for new development. It'll also, in many ways, be easier for new entrants in traditional systems to talk together, because there will be kind of these established tracks, kind of train tracks that everyone will know how to navigate, and to a certain sense, a more shared language. Ultimately, what we're looking for is a really interesting future where the patient has a complete data view of their whole journey. I think we're a far way off from that. But again, the ultimate impact is we just have to make sure we keep thinking about not just what it allows us as developers and innovators to do, but it's all in service of the patient and them not necessarily feeling like they get lost within the system, and that they can learn from others who have gone through similar experiences that they have, right, in informing their treatment decisions and others. Okay. Next slide. Julie, I think back to you.
Yeah, so we wanted to end on kind of assuming all of these features of the future state of healthcare to be true. What opportunities does this open up for developers, innovators looking to inflect change and innovation in the healthcare space, or to take advantage of those changes to kind of further propel innovation and evolution of healthcare over time? So we've aligned kind of each of these opportunities to the 6 features that we've highlighted. The first, thinking about that greater diversity of providers and players in the future state of the healthcare landscape, kind of that recognition that this will result in untapped stakeholders as both potential customers as well as potential end users of digital health solutions. So as developers, how can you think about servicing or positioning the solutions that you're creating and you're building to be not just applicable to the traditional legacy healthcare stakeholders, payers, providers, pharma, but also some of these emergent players that are operating in retail care or trying to play a role as big tech companies entering into the healthcare sphere, or kind of platforms that are focused on virtual first care delivery or otherwise, and keeping that full spectrum of potential stakeholders in mind in thinking about how they may engage with the solutions that you're working on in different ways than perhaps legacy traditional healthcare players might. Second is recognizing that the shifts in care delivery will have an influence on the care decisions that are being made, thinking about greater opportunity to learn more about a patient over time in different modalities and via the cohesion across both settings and modes of care, and then using that to increasingly adjust care plans, treatment decisions, et cetera, throughout the patient's journey, dealing with a condition or preventative care. Third, we expect that the bar will kind of continue to be raised in terms of what good looks like for a patient experience, in part driven by the kind of influence of patients and caregivers themselves as they're becoming more influential in the healthcare setting as true decision makers. But also, I think that in healthcare overall, there's becoming greater recognition that we need to kind of go back to really focusing on patient centricity, and kind of, as Adriana was alluding to, really holding the patient as central to everything we're doing and the innovation that we're driving towards in the healthcare space. Kind of moving to the upper right, we expect that really it'll almost be kind of expected or a baseline requirement that there will be digital innovation in science to be competitive, both as it relates to life sciences, drug development, clinical trials, in thinking about identifying the best suited molecule, the best aligned target, and the speed with which to bring those pipeline assets into the market, as well as in terms of thinking about care delivery and optimization of clinical outcomes, as well as economic impact of the choices that are being made in the care delivery realm, and how technology and digital solutions and even AI can really drive improvements across both of those assets or facets. Next up, we have already talked kind of at length about the role of AI in both driving efficiency and novel capabilities. We think that we're at just the early innings where we've seen most of the effort around efficiency, but at the same time recognize that there's more opportunity in efficiency to be gained as we become more comfortable and confident in AI. And I think also kind of expanding that to new capabilities that are kind of would not have been possible in the world before AI, and what type of impact that could unlock in the healthcare sphere. And last but not least, we see that the increasing amount of data and connections between data silos will really unlock new possibilities when you're applying analytics or using that data to drive digital solutions or drive decision-making in the context of healthcare, really leading to greater opportunity overall. So these are some of the opportunities. Pause here to see if there's any questions, comments, even if kind of folks from the audience see different opportunities aligned to the future state of healthcare. And then the last section we'll close off on is just talking about how innovating in healthcare is really hard, and kind of recognizing that.
I think leading into that, but touching on this, so I'm trying to figure out the right way to frame this question. So when early stage companies see trends, so for example, I like the slide talking about AI for efficiency versus new capabilities. Do you think that early stage companies should look at that and say, well, the big players are dominating the efficiency side, so that means I should focus more on the new capabilities? Or is it more of I think, everybody's going to be flooding to new capabilities, so maybe I should pay attention to the opposite direction of the trends? Does that make sense? Like, how should innovators think about using trend information?
Yeah, I think you kind of need to dig a bit deeper into the trend to figure out how to play a role as a startup or an innovator in the space. I think first, it's helpful to understand in terms of the opportunity you're targeting or the use case that you're considering developing. What does the competitive space look like? Is it really crowded? Is it fragmented? Is it pretty much white space at this point in time? And then digging into why that might be the case.
Mhm.
Having that contextual understanding, I think then really help frame the question of, is there something special or unique, if you will, a competitive moat or differentiator that I, as an innovator, bring to the table that will separate my solution from the rest of the pack? If there is a pack, I think is the context I'm teeing up. And if so, I think that's still a good area to focus on, but just thinking ahead so that you're not trying to be a quote unquote me too product alongside a very crowded space where there's not much variation and differentiation, and just adding kind of an additional option and potentially a latecomer. I think as long as you can differentiate in a way that's kind of a bit of a competitive moat and something that is unique, there's still opportunity to tap in and carve out a space amongst an area that others are already focused on.
And I think just adding to Julia made some really smart points around differentiation in particular, right? That's going to open front doors. And I think that's something we have to think about, right? As soon as an area or a certain technology starts to gain ground, you're going to have a lot of knocks at the door if you're an enterprise customer. And so the question is, how do you open that door? The other thing that's really interesting to think about is the importance of, I guess, kind of two things. One is going back to that conversation about what is the burning need, right? Always making sure that you are coming in and someone is nodding their head and saying, yes, that is a problem I have, or yes, that is something we've been talking about. There's also some really interesting, it sounds like there might be some earlier stage folks in the call, is the ability to think about pivoting, right? It's that flexibility is so important because you're going to get a lot of feedback when you start to engage in those conversations with potential customers. You're going to really quickly learn if you're not a burning need. You're also really going to quickly learn if you're in a space, to what Julia said, there's a lot of fast follower activity, and it might come to a race to the bottom, quote unquote, situation when you think about kind of move to commoditization. And you want to be careful that you're picking up on those feedbacks and that feedback and really thinking about your path. Your time, if you're a developer, is your greatest resource, right? Like what questions you're working on, what hypotheses you're putting forward. And so even if you're kind of running with idea, be ready to pivot to potentially add a new feature, or maybe go tweak it to look at a new opportunity or bring in a new differentiator. Or you might have to think about if the margins are going to work out, right? For based on what the competitive activity looks like in the space.
Great. I know that can be frustrating for companies trying to sell a long-term vision, but the customer is really focused on putting out those near-term fires. So that's definitely a set of hard conversations to have.
Yeah, and I think getting buy-in from folks first that do see the vision and then can help others kind of come along that journey to see the vision is really important when that's kind of the angle that you're operating in. And it is a more longer term to impact, or to having a MVP ready and you're looking to fundraise for investors, for example. Really aligning yourself to people who understand, buy into your vision, and can help you better shape that and communicate it to others who might be more focused on the day-to-day fires and burning needs, etc.
Any other questions before we move on? Oh.
Okay, we just want to briefly talk about kind of really some of the things that make innovation in healthcare specifically quite hard, and recognize that the work that you all are doing as developers, building new solutions, platforms is challenging, and highlight some mitigation strategies that we've seen be successful in relation to these various challenges. So we have 4 that we're highlighting today. I don't think these are comprehensive of all the challenges you may be or will face as you innovate in the healthcare space, but I think worthwhile to note and raise and kind of chat about briefly. So first, recognizing that healthcare is a multi-stakeholder industry and that there's variation in incentives, priorities, and tensions among those different stakeholders. It's really important in some of the way to ensure you're operating effectively in this complex environment is to understand the solution you're working on in the context of all those different stakeholders who will directly interact with your solution, and also who will be directly and indirectly impacted by your solution, because that might not just be those people who physically buy or touch and are end users of the solution itself. There might be downstream or even unexpected effects, just given the web that is healthcare. Already alluded to this idea of misaligned incentives, which often create inefficiency, gap, and tension across healthcare players. Developers and innovators really need to clarify what they're offering and how each stakeholder will benefit in order to sell the idea of the value proposition and what they're offering to the different stakeholders. Unlike startups, unlike tech ecosystem, healthcare is inherently slow moving, especially when we're thinking about the large incumbents. We have seen anywhere from 6 to 12 months just to get contracts in place to run proof of concepts, pilots with health systems. We've seen similar length contracts to work with pharmaceutical companies for the first time. I think enterprises also are recognizing this challenge and looking for ways to move more quickly, streamline some of those processes that can be a headache. But it's important that early stage startups and innovators and developers recognize that at least currently healthcare is slow moving, and that they develop a business model that really has an easier kind of point of entry into whoever their target customer will be, and also keep that in mind from a financial modeling perspective for the health of their business as well, and that they have long enough runway to deal with the slow moving nature of the healthcare ecosystem. And then last but not least, kind of a double-sided coin, but we do recognize that the healthcare innovation market is maturing. There's some areas that are still nascent, but we do have precedent for what it looks like to scale in chronic disease management, in telehealth, and what success looks like in those solutions. Those are also harder places to enter, but regardless of whether you're looking at a more nascent area or a more mature area, really comes back to this idea of differentiation and ensuring that you're able to educate partners, investors, customers about how your solution is different and can add value to what they're doing day to day. So hopefully, as we went through this presentation, you kind of could see the connections between the trends and the opportunities and some of these challenges and mitigation strategies. I know we've run almost up till time, but happy to take any questions, or Dennis, happy to pass it back to you.
Sounds great. Yeah, thank you very much. It's definitely challenging and exciting to build new things in healthcare. So I will drop a couple of things in the chat here. Just if you do have questions to follow up, we have the Intelligent Platform, which has contact options, or we have an email address directly. But any other questions to close us out from the audience? Okay, sounds good. Well, thank you everyone for joining. Thank you, Adriana and Julia. Fantastic, useful information, and we really appreciate you joining us today.
Thanks all.
Thanks all.
Thanks, everyone.
Right.